Hi, thank you for your interest in becoming an Umbrella Project partner. In this video, we will go through what the Umbrella Project is, the services it provides, and how you can become part of the Project Partner Network. The Essex Sexual Health Service Umbrella Project supports sex workers across Essex, excluding Southend and Thurrock, through the distribution of health resources and online support channels. This service is open to anyone over the age of 18 of any gender that sells sexual services of any kind, regardless of immigration status. The sections of this video are time-stamped so that you can return to your sections of interest. First, a little bit of background information about the project. As defined by ADPH Yorkshire and Humber, sex work involves the exchange of sexual services between consenting adults in return for money, goods, or other agreed benefits or needs. There is a broad spectrum of people involved in sex work, and the type of sex work may include on-street, off-street, and webcam work, and not all of these people will identify as sex workers. So why the Umbrella Project? A red umbrella is a nationally recognised symbol representing sex worker rights and freedom from discrimination, with the colour red representing love and an umbrella representing protection. Because this symbol is already recognised within the community, the service has decided to call the project the Essex Sexual Health Service Umbrella Project and have a logo of a red umbrella. In England, it is legal to exchange sexual services for money. However, it is illegal to solicit these in a public place, own or assist in the management of a brothel and advertise sexual services under the Modern Slavery Act. However, because this is a confidential, non-judgmental service, the Umbrella Project is not in place to incriminate any service users. The project instead aims to prevent the adverse health and well-being consequences from sex work, whichever form it may take. The project has signposting pathways in place if a service user was to disclose that they were a victim of sexual exploitation, modern-day slavery, sexual assault or rape, and would ensure to help them access appropriate support. If a service user discloses that they would like to exit sex work, the staff will direct them into appropriate support services. If someone under the age of 18 tries to access the programme, staff will be responsible for making a safeguarding referral to protect the young person and keep them safe. This is because an individual under the age of 18 is recognised as a child by law, and this would be classed as child sexual exploitation. However, appropriate support could be provided outside of the programme. Evidence and framework shows that sex workers often experience multiple overlapping risk factors for poor health. From lifestyle factors to lack of access to information, there may be many barriers stopping sex workers from accessing health opportunities. Therefore, the Umbrella Project aims to overcome these by offering different types of services in the form of physical care packages and online support. This is where the project partners come in. The ESHS Umbrella Project is run by the Outreach and Education team from Essex Sexual Health Service as part of Provide Community, and the service is commissioned by Essex County Council. However, the project consists of a collaboration between many support services across Essex, who are able to distribute sexual health resource packages on behalf of ESHS Umbrella Project to anyone that accesses their services and discloses that they are a sex worker living or working in Essex, excluding Southend or Thurrock. ESHS Umbrella Project partners can distribute leaflets so that the individual can join the project's Telegram platform and access a variety of sexual health support services, as well as provide their own specialised support. An up-to-date list of all the project partners is available on the Umbrella Project website at eshs.org.uk/umbrella. Now we'll take a closer look at the care packages, further sexual health resources and online support pathways provided by the project. Umbrella Project partners can offer free care packages to anyone that discloses that they are a sex worker. These care packages contain 20 condoms, 15 water-based and 5 silicone-based lube sachets, general health resources, which may include items such as wet wipes and hand sanitizer, Umbrella Project information, including the project's Telegram broadcasting channel, where people can receive regular sexual health updates and support, as well as being able to chat directly to a member of the ESHS Outreach and Education team. Dental dams, internal condoms and menstrual products may be available on request. By engaging with the Umbrella Project, individuals will also be able to access a fast track into a variety of sexual health and contraceptive services and appointments, including free hepatitis and HPV vaccinations, as well as information about accessing mpox vaccinations, free emergency hormonal contraception, order up to 20 free condoms and lube once a week, free PEP and PrEP prescriptions following an assessment, free pregnancy testing, opportunity to order more than one free online STI test kit per month, support into our specialist partner services, including the Essex Wellbeing Service for free health and lifestyle checks. Individuals can access these services either by messaging the outreach team via Telegram or by saying to the phone operator at the Essex Sexual Health Service Navigation Hub that they are part of the Umbrella Project. Sex workers that have access to a smartphone will also be able to use the Umbrella Project online support services. The Umbrella Project provides online support to sex workers in two ways, through the Umbrella Project Telegram account and the Umbrella Project Telegram broadcasting channel. The broadcasting channel is a one-way form of communication, allowing the Essex Sexual Health Service team to send all its Telegram followers up-to-date information about sexual health trends, information about accessing the Umbrella Project resources and upcoming events, whilst maintaining the anonymity of its followers. Meanwhile, the ESHS Umbrella Project Telegram account is a platform in which sex workers can speak directly to the team about sexual health services available to them, including questions about fast-track offers, general sexual health advice and safeguarding support. Telegram is a popular app used by sex workers due to its unique end-to-end encryption. This means it offers more anonymity and security for its users compared to other communication apps such as WhatsApp and Facebook Messenger. Telegram therefore provides the opportunity to communicate with local sex workers who may already be familiar with the platform. All this information is contained in an ESHS Umbrella Project leaflet and website, distributed by Umbrella Project partners when someone discloses that they work in the sex industry. Alongside this leaflet, there is a small business card that contains basic information at a more discreet level with a QR code to scan for more information. Becoming an Umbrella Project partner is free and easy. To register, go to the Umbrella Project website, eshs.org.uk/umbrella, and fill out our new partner form. Our team will then get back to you to coordinate training and resource distribution. Services that sign up to become distributors of sex worker care packages will have to have attended a short Umbrella Project overview training session in advance. This can be accessed virtually and can be delivered within team meetings or face-to-face. The aim of the training is to provide an overview of the project and the support it can provide, take a brief look at barriers often faced by sex workers for accessing support, and outline the signposting pathways available for further support, included but not limited to employability support, homelessness support, and drug and alcohol recovery. If you have any questions about the ESHS Umbrella Project, please email provide.eshsUmbrellaproject@nhs.net. Thank you.